Hi everyone, Nicole Moore, low carb keto health dietitian here. Hopping in today to have a chat about metabolic syndrome. People often do ask me, what is metabolic syndrome? Am I at risk of metabolic syndrome? Do I have metabolic syndrome? So here's the rundown, and if you are ticking some of these boxes that we talk about today, then it's really important that you see a low carb specialist like ourselves to really help put those particular conditions in remission, because metabolic syndrome increases your risk of cardiovascular disease and heart disease and diabetes and chronic disease in general. So please also make sure you share this video with anyone else that you think might be at risk, because you can put metabolic syndrome into remission and you can really prevent long-term health problems. So what is metabolic syndrome? And metabolic syndrome is a cluster of conditions, and if you have three of the conditions, then you are classed as having metabolic syndrome. So what are those conditions? So one of the conditions is having a high waist hip circumference, and really all that means is that you've got extra belly fat sort of sitting around your midsection, which increases your risk for metabolic syndrome. So usually a waist hip, which you can do sort of where your belly button is, if it is greater than 80 centimeters for a female, and if it's greater than 90 centimeters for a male, then that is one of the risk factors indicating that you have metabolic syndrome. Another risk factor for metabolic syndrome is that you have high triglycerides, and basically if you've got triglycerides that are greater than around about sort of 1.6, 1.7, then that is also a risk factor for metabolic syndrome. And triglycerides are a fat in the blood that can increase your risk for cardiovascular disease. So we've got high waist hip or belly fat, and if your waist hip is greater than 80, for females greater than 90. Another risk factor is that you have high triglycerides greater than 1.7. Another risk factor is your blood pressure, and ideally we're looking at anywhere sort of 130 over 85 is your sort of general healthy range. So if you're sitting above 130 over 85 for blood pressure, and so that's sort of mild hypertension, then that is another metabolic risk factor. So that's 3 so far. Also good cholesterol. Good cholesterol we call HDL. And if you have low good cholesterol, and you'll be able to see that on any sort of lipid blood test that you would have or should have had sort of in the last 12 months. And basically if it is under 1.3, then that is also another risk factor, because HDL or good cholesterol kind of acts as it hugs our bad cholesterol and helps protect our body, I guess. So so we've got the blood pressure at 130 over 85 if it's higher. We've got waist hip, belly fat greater than 80 centimeters for females, greater than 90 centimeters for males. We've got your triglycerides if they're really above that 1.7, and I'm really looking at if it's 1.5 or greater. So it's a blood fat. If your good HDL cholesterol is lower than sort of 1.3, and also blood sugars. And really blood sugars greater than 5.6 is a risk factor for metabolic syndrome. And I just see so many people and they're sitting at 5.7, 5.8, and no one's really discussed with them that this is a very early pre-diabetes state, and really we shouldn't be waiting for them to get to 6 to be told that we have risk factors. So all of those things I've discussed with you, even cholesterol, if you've got high cholesterol, that sort of starting to look at, if we're looking at your LDL, if your LDL really is starting to sort of sit above the 2 millimole mark to 2.5, then that is another risk factor really included in sort of metabolic syndrome. So if you're sort of got a blood pressure that's higher than, a triglycerides, that's higher, a blood sugar that's higher, a waist hip that's higher, your triglycerides, I think I said that's higher, and having a low good cholesterol of HDL, then these are all metabolic markers that are indicating that you have a risk or you are sort of in that metabolic syndrome area. And so you really only have to have 3 of those boxes ticked to be at metabolic syndrome risk. So have a look at what your current bloods look like, check your waist hip, and look at what your recent blood pressure markers were. And if you're starting to tick those boxes, then you're at metabolic risk. And let's not wait till we're ticking 3 of those boxes. Even if you're ticking 2 of those boxes or 1 of those boxes, getting on top of it now using a low carbohydrate approach is really essential, because low carbohydrate diets will improve all those things. When we look at metabolic syndrome and you go back, the root cause of that is insulin resistance, and insulin resistance is creating fat around the midsection, and all of those things then create risk of increasing or lowering your good cholesterol and increasing your triglycerides directly. So it's also going to obviously give you a higher waist hip. And insulin resistance is actually also directly linked with blood pressure, not only because we're creating belly weight, and belly weight can increase blood pressure, but actually elevated insulin can actually block the nitric oxide pathway. And nitric oxide is a vasodilator. That means it opens up our blood cells, our blood vessels. So if you've got insulin resistance and therefore metabolic syndrome, is that you've actually could be blocking the nitric oxide pathway, which is why your blood pressure is also elevated. And at our low carb keto health practice, we see often people's blood pressure dropping. In fact, when people have got normal blood pressure, we have to recommend adding some salt to their diet, because when you start lowering carbohydrates and thus lowering insulin, there are 4 sites on your kidneys that actually excrete sodium at an increased rate. So people who have normal blood pressure can often experience hyponatremia and reduced salt in their blood. They excrete more fluid and their blood pressure drops, which is not great if you don't have blood pressure, but it's great if you do. So a low carbohydrate diet directly impacts insulin resistance, and it will lower triglycerides in your blood. And when your triglyceride levels lower, your good cholesterol increases, because your good cholesterol goes, well, I'm being put on a holiday, I don't need to kind of take care of those high triglycerides and try and sort of, protect the body. So the good HDL goes up, the triglycerides go down when you do a low carbohydrate approach. You lose weight around the belly because insulin stores fat around those visceral, around the organs and the visceral fat, and increases your belly fat. So a low carbohydrate diet sorts that out. A low carbohydrate diet lowers blood pressure as well. And we absolutely know a low carbohydrate diet lowers your blood glucose, because when you're not eating that carbohydrate and your body starts to make ketones as your fuel, your overall blood sugar lowers. Your body becomes a ketone user and fat adapted, and so the mitochondria in our bodies can use ketones as its energy source. It doesn't therefore rely on carbohydrate. And so even if we're not eating copious amounts of carbohydrate and we're dropping it to 50 grams a day, our body's a machine. It can actually make the small amount of sugar that it needs, and it relies on making ketones from fat, and that comes from our belly fat, our liver fat, and the good healthy fats in our food. So a low carbohydrate diet will absolutely help put metabolic syndrome in remission. And so that is what we do on a daily basis here at Low Carb Keto Health. We see people's blood markers, blood pressure, waist hip drop and melt away, and people improve and reverse metabolic syndrome and become super healthy. They feel energized, their brain fog goes away. They all say to us, I'm not hungry anymore. Inflammation drops, inflammatory markers drop. So if you are ticking any of those boxes, 1 or 3 or more, please make sure you visit us at lowcarbketohealth.com.au have a look at our amazing 12-week program. Yes, in 12 weeks, we can help you shift your metabolic syndrome. Absolutely. Please share this with friends and family that you know maybe are also ticking some of those boxes, because if you can get on top of it now, you can really just improve your life and your health and feel absolutely amazing and energized. So I hope that gives you a little bit more information about metabolic syndrome, and please share this with other people, because really I think people are just trying to run on that treadmill only and eat a low-fat diet, and they're not improving their metabolic syndrome. So hope that's some helpful information. Please share that with other people. Please visit us at lowcarbketohealth.com.au, and definitely check out our low carb 12-week program. Lovely to chat to you today, and I look forward to chatting to you again soon. Bye for now.